Good day, everyone, and we will continue our discussion on lesson 16 to 20. So, for lesson 16, we will be tackling the parts of a statistical table. And when you talk about the statistical table, we do have an overview that we are understanding the components of statistical table, which is crucial for accurate data interpretation and presentation in nursing research. We also have the relevance to nursing, which statistical tables organize data effectively, allowing nurses to make informed decisions based on research findings. And its applicability is by mastering the parts of statistical table, students enhance their research skills, particularly in data analysis and reporting. So some of the learning objectives that we are considering is that student will be able to learn about each component, including the title, stub, box head, body, and footnotes. Students will also practice converting tabular data into coherent written narratives relevant to nursing research. So in terms of organizing data, statistical tables provide a clear and organized way to present large amount of data, making it easier to interpret trends and patterns in nursing research. As we can see in our book, the tables are being presented in chapter 2, which is the treatment of the data that is being run with a statistician in SPSS. We also have to consider that tables help distill complex information into an understandable format, ensuring that research findings are accessible to wider audience. So it's very easy for us to see the data that are being interpreted as to how it is being organized and how it is being presented by the researcher in terms of getting the mean, in terms of getting the percentage, the standard deviation. We also have different variants of analysis and even regression if we are doing predictable studies. Supporting evidences based on practice is accurately presenting the data, which statistical table supports nurses in making informed decisions that improve patient outcome. So it's very easy for us to determine as to what we are going to do with our patient if these tables are well presented. So say for example, in our study, if we happen to have certain product of the statistics that we are doing, we definitely provide some interpretation into it, and we are making it sure that in every interpretation that we're doing based on the presentation of the table, it is bound to empirical evidences and even contextual evidences that needs to be supported by the researcher. So we also have the title should clearly convey in the content and purpose of the table, enabling readers to quickly grasp the data being presented. So in a table, there should be a title. So the title should somehow follow the APA 7th edition format in which the title should be seen above. Its relevance in nursing research is that the title often reflects key variable or outcomes, helping to focus the reader's attention on critical data points, making sure that the title is not that long and not too short, making it sure that whatever is being presented on that particular table would somehow be relevant to its title. The conciseness, while being descriptive, the title must also be concise, avoiding unnecessary details that could obscure the table's main message. So it should not overshadow the content of the table in terms of the title. So the title must be striking, and at the same time, it should be concise in a manner that the reader will be able to identify it and won't be confused as to what are being presented. We also have the stub, which is the leftmost column in a statistical table listing the variables or categories being studied. The stub head serves as a label for this column. So when you talk about the stub, these are the items being seen in your questionnaire. So when the statistician is trying to present the table, the items are being placed in the left portion of the table in which we can identify as to what statement are being treated or what are being presented in the table. Another thing is that in nursing research, the stub often represents key patient characteristic, interventions, or outcome, allowing for easy comparison across these variables. So it would somehow depend into your study as to what particular stub are you using. Usually these items came from the questionnaire based on the variables that we are studying, and these are considered as well the dimensions of the questionnaire that we are presenting. So in terms of organization, the stub ensures that the data is presented logically, making it easier to interpret and analyze. Sometimes in the questionnaire, it is being presented into different cluster in a way that it should be organized, and at the same time, it somehow it won't confuse the reader or the one who is answering, no, the questionnaire. So when it is being presented in a table, particularly in a stub, and even having a stub head, it should somehow be presented as to how it is being presented based on the face validity of the questionnaire. So we also have the box head. When you talk about the box head, it is the top row of the table listing major categories under which data is organized. It includes headings for each column. So it's very important that we place heading in every column of the table so that readers would somehow be guided. Usually these are the treated data, particularly headings, which are the treated um, statistical definite I mean statistical terms that are being used, no, in your study. So say for example, when you talk about the percentage, you need to consider the entire word of placing percentage, or probably it is being presented with its mean. There should be mean, no, that is being placed in the box head to make sure that we will be able to know as to the numerical figure are being represented well in terms of the treated data. And under the main heading, there may be subheadings that further classify the data, providing detailed insight into each variable. So it would somehow depend into your study if you have some subcategories or sub-dimension in your questionnaire, because it's one way or another that we are also considering how it is being properly labeled so that readers or the one who's trying to interpret the table would somehow be guided. So its importance in research is the box head helps to structure the data by categorizing patient outcomes, treatment methods, or demographic details. So it's very important that we have to consider its importance in its headings. Why? Because it's one way or another that we're able to identify, particularly a very good example of which is the demographic details of the patient or the demographic profile of the patient, in which there should be proper labeling as to the sex, as to the gender, as to the income or the year, no? Particularly if you are considering nursing students, okay? And at the same time, the frequency, its distribution, no, should also be properly labeled into its column. So we also have the body of the table. So the body of the table contains the actual data or information being presented. It's organized according to the categories and variables defined by the stub and box head. So whatever is in the body of the table are numerical figures already. Somehow, in the body of the table, we also have the interpretation, particularly if it's accepted or not accepted, or rejected or not rejected, no? So these are some of the remarks and some of the numerical figures that can be seen in the treatment of the data. So we also have the interpretation. With this section, the tables allows comparison between different variables, providing insights into trends and relationship, which are vital in nursing research. So usually if you're doing correlational studies, those looking into the differences, particularly with t-test, no, you also have to consider the treated variables which undergone into chi-square or Pearson R. There are interpretations somehow presented into the table, no? And even regression analysis are also being considered as having certain interpretation, no? And for the accuracy, it's ensuring accuracy in the data presented, which is crucial, as error can lead to misinterpretation and impact clinical decision making in nursing. So there come a time that the data that are being treated are not correct. So it's very important that we have to consider a statistician who is somehow knowledgeable in terms of treating the data in order for us to have an accuracy. So for the footnotes, this is seen in the bottom part of the table. This is actually in a smaller font. Somehow it has also been italicized, no, based on the seventh edition of the APA format. Its purpose is to provide additional context or explanation for specific data points, enhancing the reader's understanding of the table. And in nursing research, footnotes often clarify measurement methods, abbreviations, or data exclusion, ensuring accurate interpretation. We also have the placement, which is typically placed at the bottom of the table, which clearly referenced by symbols or numbers within the table body. So usually in the footnotes, these are the parameters of the Likert scale, no? And usually it's guiding the readers as to what are these figures are representing for. We also have the source note. So in terms of its indication, its origin of the data presented in the table, lending credibility to the research findings. We also have citing sources in nursing research tables, ensuring transparency and allow others to verify the data, which is critical for evidence-based practice. And source notes should be concise yet complete, including all necessary information to trace the data back to its original study or data set. Very important that in terms of source note, this would somehow come from your review of related literature. No, these literature are being used and being considered in your chapter 2 based on the numbers that are being presented, and those corresponding numbers are being interpreted in a way as to how it is being translated into the contextual aspect, and at the same time providing empirical evidences, particularly with your observations and even your experiences. So in terms of the guidelines of writing a textual presentation, we have to first begin, no, by identifying the most significant data points in the table that are relevant to the research question or hypothesis. So usually in the table, if it's found to be significant, that is our focus. But somehow, if the interpretation is not significant, we usually look into what is the higher and what is the lowest. No, so the highest and the lowest numbers are considered to be interpreted, and it should be well presented during the textual presentation. We also have to describe trends and patterns. So we need to convert the numerical data into descriptive text, highlighting any noticeable trends, patterns, or relationship. And we have to explain the significance of the data within the context of your research, linking in it back to the nursing practice or patient outcome. So we have to still consider and relate it as to the study, particularly with the respondents, with the environment, no, on how it is being related. Okay. So we also have some examples in nursing research, particularly its practical application. We do have case study analysis, in which nursing research often involves case studies where statistical tables are used to present patient outcome or treatment in its efficacy data. A very good example of which are case study analysis or case study presentation, not the end of your RL irritation. We do have case studies, and usually these tables are being presented, no, particularly in which part of the case study, usually in the laboratories, which are being presented into table, or particularly with your nursing care plan, which is being represented into table drug studies. And so these can be evidently seen in terms of how data is being presented. We also have the survey result, which tables are commonly used to summarize survey data in nursing studies, such as patient satisfaction or nurse staffing level. So usually if we provide questionnaires and even survey to our patient, if they're well satisfied with the service that the nurses are giving, no, or they are able as a recipient that they're able to get, no, or experience somehow. We also have clinical trials in which statistical tables are critical for presenting data and treatment effects, adverse events, and demographic variables. So, a very good example of clinical trials are, say, for example, medications that are being piloted, new medications that are being researched. No, so we have clinical trials being conducted, particularly in some of the population in which the drug company is trying to identify, no, so in that way, if they're able to do the trial and error already, and at the same time do the before and after test, no, usually it's being presented into a table so that we can see the treatment effects and even some side effects and adverse effects based on the population that are being researched. So to recap, we have understanding of the different parts, and there is a thorough understanding of the components of statistical table, which is essential to effective data presentation and interpretation in nursing research. These skills are directly applicable to various research contexts, from writing reports to conducting data analysis in clinical trials, and practice constructing and interpreting statistical table to enhance your research skills and contribute to evidence-based nursing practice. Now let's proceed to lesson 17, which is writing a research report. Very important that the research, as a researcher, report is structured, documents that um, presents the result of the study, which is critical in communicating findings in nursing research. And its purpose is that research reports help in disseminating knowledge, influencing practice, and guiding future research within the nursing field. And its applicability is how we tend to understand, not to write a research report, which is essential for nurses who wish to contribute an evidence-based practice and scholarly discourse. In terms of the definition, a research report is defined as a formal document that presents the method, findings, and implications of the study. It is essential for documenting and sharing research in the nursing field. And its role in nursing is that research reports contribute to the development of nursing knowledge, guiding practice improvement, and informing policy decisions, and its standardization is following a standard format, ensuring clarity, consistency, rigor, and how research findings are well communicated within the nursing community. So, a very good example of a research report is what we're doing right now. We're creating a thesis book, no, and in our own little ways, no, in our humble ways, no, and usually these research reports are considered to be evident, and at the same time it can somehow contribute to the nursing profession because we are doing the research because we find a certain problem and we tend to address the gap, no, of that problem. Now, as student nurses, these are our challenge. This is our challenge, no, in terms of how we have to make how we make sure that the book should somehow be concise and also presentable in such a way that data are not being manipulated and of course data are well treated. So for the title should be concise and descriptive, clearly reflecting the content and focus of the research. It is often the first element that attracts the reader's attention, no? So with this one, no, we are also considering a good example, which is a format coming from a journal, no? If you have read a particular article already, no, in a certain journal, this is how it is being presented for a research paper. Okay, so it's being publicated. It's in a Scopus journal, and at the same time, it is being shortened. No, as you can see with the number of pages as well. No, so that's also a very good example for a research paper aside from the thesis or dissertation that we are doing. When you talk about the abstract, no, it provides a brief summary of the research, including the problem, methodology, results, conclusion, and it serves as a snapshot of the entire report. Usually, an abstract would somehow consist of 200 to 250 words only without exceeding, no? Some other journals or some other books might consider abstract within 300 to 400 words, but it should not be exceeding to 500, no? Its importance is well-crafted title and abstract are critical for engaging the audience and conveying that the significance of the research at a glance. So when a reader tends to see that the title would somehow be relevant and well crafted, no, they might be curious about your study and they wanted to somehow explore and would somehow read into it, no, and how it's because of how striking it is. In terms of the setting the context, no, for the background, the introduction provides some background information necessary to understand the research problem, including the context, significance, and relevant literature. I'm pretty sure that you guys already know how to make an introduction because this is part of your chapter one, which is in NER 027. And I believe that in the introduction, it should also be highlighting your competence as a researcher, the value as to why you're doing the research, and also different situationers and observations in order for us to address the gap. We also have the problem statement, which section clearly defines the research problem or question, setting the stage for the study's objective and hypotheses if there are. So usually the statement of the problem is already seen right after we're done with the theoretical foundation, no? Or theoretical framework. Okay, so in terms of the statement of the problem, it would somehow depend if it's a quantity or quality because they are being presented in a different manner. No? And it should be systematic at the same time. And the purpose of the research is articulated in the introduction. You have to have a very good explanation as to um providing no the significance, the purpose, its meaning, no, as to why you would like to conduct the study. Okay, so that should also be incorporated in your intro. For the RRL or literature review, we have to consider here the survey existing research which are relevant to the study, particularly na these very good examples of review of related literature coming from different sources such as books, journal, even in the newspaper should not be obsolete. It should be at least not beyond 5 years, no, or within 5 years now, so you're okay. And you also have to identify the gaps in establishing the context for the new research. And in terms of the section, no, it also summarizes the findings from previous studies, highlighting what is known and remains to be explored. Because there come a time that we need to conduct the study, it's because we are playing with different variables, and with these variables that we're looking into would somehow reflect with the different in the different or the previous studies that are being conducted already. However, we just have to make sure that in the review of related literature, there should be an operationalization in terms of identifying certain literature from the previous studies. It should be in a funnel type, which should start from the international to national and then to the local context. In terms of operationalization, each variable should be well discussed, no? One way or another, and it should not be mixed, no? So that it would somehow guide the reader as they go along with the RRL. And literature review connects past research to the current study, demonstrating how it will contribute to the nursing knowledge and practice. We also have the method. So section describes overall design of the study, including the type of research, whether it's quali or quanti. Usually, would it be a descriptive quanti-quali and how it is being conducted? No, for quali, would it be COLISA? Okay. For the data collection, you need to have details on how data was gathered, including the tools, procedures, and sampling method used in the research. In terms of data collection, you need to have the pre, during, and post. That should be well highlighted from the very beginning as to how you propose your study up until the end that you're going to shred and have your to shred the papers and also the the data that are being presented and being treated with the statistician. And you also have the data analysis. So this is more into the chapter two, no? Into the explanation on how the collected data was being analyzed, including statistical method or qualitative techniques being used. For the data analysis, you have your interpretation of the tables. If you're more into the quanti study, if it's more into the quali, you need to have your thematic analysis based on the analysis that you are doing based on the saturation of the data or the data collected to your patient. So for the results, you have the presentation of data. So this section presents the findings of the study, which you guys are already doing now, I presuppose, often using tables, graph, and charts to display quantitative data. So tables are well presented if you're more into quantity. Narrative or translations are more into the quali side. So for the key outcomes, this section highlights the most significant findings from the research directly related to the study's objective and hypotheses. So this is the best way for us to at least answer the question coming from our objectives, coming from our statement of the problem, you know? So it should be well organized as well. In terms of the precision and clarity, the results should be presented clearly and precisely, avoiding interpretation or discussion, which reserved for the next section. So in terms of the interpretation of the results, discussion section interprets the findings of the study, explaining their significance in the context of existing knowledge and theory. So one way or another, in terms of the discussion, we are already proving if these theories would somehow be effective enough in terms of the study or would just be considered as an anchor towards the study or at the end of the study. And its implication to nursing as part of the report explores the implication of research, findings for nursing practice, education, and policy. No, so at the end, we have the recommendation, and part of the recommendation is more into the nursing practice, more into the nursing academy or education, policy, and even in research. So these four should be present in terms of what can you recommend, no, as to why you as to the result of the study and how it would somehow give importance and significance to those four fields in nursing. And in terms of limitations, we need to acknowledge as well the different limitations of the study, which is very important in providing a balanced interpretation of the results and guiding future research. No? So this should be done. This should be done at the end of the chapter, no, or at the end of the book. Usually, limitations would somehow be considered as to further studies or longitudinal studies that can be considered based on the pros and cons that you've experienced, no, or based on the advantages and disadvantages that you also experience while you're doing the research. And the concluding part would somehow include the summary of the findings, which includes the conclusion, which summarizes the main findings of the study, emphasizing their importance and relevance to the research question. You also have the implication for practice. Okay, so usually it highlights the practical implication in research, particularly in how it influenced nursing practice, patient care, patient outcome. And for future directions, we need to consider recommendations for future research as being provided based on the findings and limitations of the current study. In terms of references, this can be found in right after chapter 3 of our book, no, and references are found at the end of the journal. Okay. And usually in terms of citing sources, we have to have references section which lists all the sources cited in the report in APA format, 7th edition, providing full citation to ensure credit given to the original author. And for proper citation, it's crucial in nursing research for maintaining academic integrity, avoiding plagiarism, and allowing others to trace the origin of the data. And for the formatting, we have to consider then again APA as mentioned earlier as required for the publication or the institution. So usually in Southwest, we stick with APA. Also with appendices, you have your transmittal letters coming, transmittal letter to the dean, transmittal letter to the hospital if you're conducting it in the hospital, or in whichever field that you would like to penetrate in your study. For the appendices, which include supplementary materials such as raw data, detailed description of procedures, or additional tables that support the research, but are not essential to the main text. And you also have the acknowledgement. The acknowledgement can be found in the preliminary page. In this section, would somehow recognize individual organizations that contributed to the research but are not listed as authors, including founders, mentors, and colleagues. And also transparency and integrity, which is your ethical consideration. There are some format of other universities. They are placing it in the appendices, in which enhances the transparency of the research process and gives credit to those who supported the work as well. Okay, so let's proceed now with lesson 18, which is communicating research. So, effective communication of research finding is critical for advancing knowledge and improving practice in nursing. Communicating research allows the dissemination of new knowledge, contributing to evidence based practice and policy development. A nursing student must learn to communicate their research through various channels to ensure they're finding research and impact the intended audience. Okay. So when we try to communicate our research, this is more into publication and at the same time presentation in the conference, in the seminars. No? So this is one way or another that we are trying to communicate our research and we are not just placing our books in the library. So, disseminating of knowledge, we have effective communication of research, which is essential for sharing new knowledge, influencing practice, and advancing the field of nursing. So, different methods of communication ensure that research finding reach the appropriate audience. That is why we're doing it, no? In terms of the inclusions of healthcare professionals, policymakers, and also into the public. And we are also considering its impact that the way research is communicated can significantly affect its impact, making it critical to choose the right platform and format that you would like to venture out or consider. First, we do have the peer-reviewed journals. So peer-reviewed journal are scholarly publications which research is evaluated by expert before publication. They ensure the quality and credibility of research. So I do have an experience in terms of publicating my work in certain journals. Within fact, I already have 5 publications not done, and the most crucial part of the peer review is that there are series of panel who are also evaluating your output. Aside from the panel that you've presented your output during the final defense or even the proposal, no, there are certain panel of experts that are being hired in on that particular journal, no, would somehow review from the very beginning up until the end. No, so there might be some revisions that they would like to add on in terms of the enhancement of your paper. In terms of publishing in peer-reviewed journals, allow researchers to share their findings with the scientific community, contributing to the body of nursing knowledge. And its impact article published in these journals often influence clinical guidelines, policies, and best practices in nursing, which would somehow impact, especially those that are future researchers who would be interested, no, in terms of continuing your study with their capstone study, that can really help them. However, the disadvantage in terms of peer-reviewed journals is that it's costly, no? So it really I really spend a lot of money to that because aside from paying for the IRB, you also have to consider the grammarian for plagiarism check, no? You also have to do some revisions, no? And if you're going to do some revisions, no, there might be another pay again for the one who's reviewing the for the one who's trying to review your output and up until such time that it's being considered as perfect already. Okay. And it would really take time, no? So it would really take time for you to do the publication, usually 2 to 3 months, no? It also depends on how you're going to work on it, because if you can work it every day, no, based on the suggestions and just submit it on time, no, right after giving the suggestions, then they're also very good, but they're also they would always respond in terms of the concerns that you have. At the same time, if there are queries, no, they're there to respond via email. So in terms of conference and symposium, we do have the conferences which provide platform for researchers to present their findings to peers, allowing for immediate feedback and discussion. Okay, so I haven't experienced presenting it in conferences and symposium. I directly publish it with journals, no, because of the audience that I'm also considering into, no? So in terms of the networking, these events facilitate networking with other researchers, which can lead to collaboration and further dissemination of the research, no? So it is not you who will just be presenting during conferences and symposiums. There are also other presenters who would also doing it, no? And you're only given at least 15 minutes to present your study, and right afterwards are the question and answer portion, already based on the suggestions and findings of the panel of experts. So in terms of influence on practice, presenting at the conferences can help influence practice by bringing new research directly to the attention of the healthcare professional and the decision makers who are attending as well with the conferences and symposiums. We also have workshops and seminars. No, so this is one way to provide opportunities to interact, for having an interactive learning, rather, no, where participants can engage directly with the research and its implication. And at the same time, if it's in a workshop and seminar, there are a lot of participants, no, who would somehow give advice or give feedback based on your output. And these sessions often focus into developing specific skills related to research, such as data analysis or research methodologies, because there are some participants who are really into the methodology of the study, some of which are more into the contextual aspect, no? Or the other is more into the content analysis, no? So it would really depends as to who are the audience as well in terms of the seminar and workshop. And for nursing professional, workshops and seminar offer a chance to apply new research finding in a practical setting, enhancing their practice. We also have posters and infographics. Its purpose is through visual tool used to present research finding concisely, making them accessible to a wide audience. No? So usually this is done through posting and also done through standee. No? It's also being printed with the tarpaulin, and it is being presented outside in the conference, seminar, symposium, no, in which they're also being um um also given with some critique, no, of these panel of experts who are also judging it, no. And at nursing conferences, posters and infographics are commonly used to convey complex information quickly, facilitating discussions and networking. And effective posters and infographics should be visually appealing with a clear structure, concise text, and impactful graphic. In terms of social media and online platform, it has a wider reach. Through social media and online platform allows researchers to reach a broader audience beyond traditional academic circle, including the general public. And at the same time, these platforms facilitate direct interaction with the audience, enabling researchers to engage the discussion, answer questions, and clarify findings. And its impact on nursing is more into sharing research online can influence public health education, policy discussions, and global nursing practices. So usually these are done through live interactions. No, we can also provide that kind of platform in terms of reaching wider audience because it's one way of interacting them directly and at the same time answering questions which needs to be clarified during that time. Oral presentation is something to do with the same as with your conference and even with your symposium, in which oral presentation require clear and confident delivery with a focus on conveying key points and engaging the audience. And presenter must be able to adapt their message to the audience, whether it's fellow researchers, healthcare professionals, or the public. And in nursing, oral presentations are often used to share research findings with colleagues, influencing practice and fostering professional development. So this is what we're gonna do, no, at the end of the SEM, in which this would be your final, the oral presentation or the oral revalida would take place, no, in our P3, which is our culminating activity at the end of the SEM. We also have policy briefs and reports, in which policy briefs and reports summarize research finding within the intent to informing the influence healthcare policy and decision making. And these documents are typically directed to policymakers, healthcare leaders, and stakeholders who can implement changes based on the research. And effective policy briefs can lead to significant changes in healthcare practice and policy, directly impacting nursing and patient care. We also have collaborations and partnerships. So those individuals who would really like to adapt your study and would like to consider as well, no, adapting your study to their locale and even extending again, no, research in terms of longitudinal studies, which collaborations allow researcher to build network with other professionals, sharing knowledge, resources, and expertise. We also have partnership often lead to interdisciplinary research, combining different perspectives to address complex healthcare issues, and collaborations can enhance the quality and scope of nursing research, leading to more comprehensive and impactful studies. And to summarize, effective communication and research is essential for influencing practice, policy, and advancing the field in the field of nursing. Student nurses and professionals should leverage various communication methods to ensure their research are intended impact. And we have to continue developing communication skills by practicing these methods in our own ways of research and professional practice. Now let's go to lesson 19, which is planning for publication. So as mentioned in the previous lesson that publication is also one way for us to reach our audience. However, one of our main goal why we're doing research now in the College of Nursing is that we also would like to venture into publicating your work or output. So in terms of planning for publication, which involves understanding the requirements, and expectation of academic journals and preparing your research accordingly. And publishing research is essential for advancing nursing knowledge, influencing practice, and contributing to the scientific community. And nursing students must learn to effectively plan, prepare their research for publication to ensure it reaches the appropriate audience and has a meaningful impact. We usually suggest it to our students that when they try to publicate, it should be in a Scopus journal. And when you talk about Scopus journal, it is a wide array as to the audience that they are targeting. And these are renowned journals, and these journals are already being trusted. Okay. So in terms of the learning objectives, students will understand process of writing research publication, including key consideration strategies for success, and students will be able to learn sequential steps involved in preparing and submitting a research article for publication in nursing journals. So why do we need to publish? So when you talk about publication, it's essential for advancing nursing practice, contributing to the body of knowledge, and establishing yourself as an expert in the field of research. No, and it's very important as well that with your published research, it can somehow influence the different guidelines in the hospitals or in the clinical setting, inform policy decisions, and improve patient outcome because we are really doing research because of our patients or clients who are the one of the significance of our study. No? We also have publication increases the visibility of work, which leads to recognition and opportunity for collaboration and professional growth. Okay, because there might be some other nurses who would have an interest of your work. So you have to choose the right journal, which involves understanding who your audience is and selecting a journal that targets those readers. And consider the scope and impact factor of the journal to ensure that it aligns with the research topic and goals. And be mindful that when you try to review the journal submission guidelines and requirements to ensure that your manuscript would somehow meet the necessary criteria needed, because in every journal they do have different format in terms of publication. So, in terms of complying with the requirements, carefully review the author guidelines provided by the journal to ensure that your manuscript adhere to the format, style, and structure. You also have to consider the formatting. The formatting in terms of citation, particularly if it is APA or MLA or Turabian. You also have to consider ethical consideration in which you run it through IRB, which I suppose that everyone is doing this to adhere with the ethical guidelines, including those related to plagia, authorship, and conflict of interest. IRB is different in running your output with plagiarism check or with Turnitin, okay, to make sure that there would be no conflict of interest and at the same time the authorship is validated. You also have the standard structure, which should be in IMRAD format. So when you talk about IMRAD, it's the intro, the method, results, and discussion, and each serving a specific purpose. So usually with our book, it's more than 100 pages, no, in terms of what we produce in our thesis. But if you're going to convert that into a publication output, using the IMRAD format, usually it would be trimmed down to 10 to 12 pages. No, there are some journals who doesn't want to exceed the number of pages more than 10 or equal to 10. No, usually it's lesser than that. The lesser the page, the better, because it's one way of enticing your audience to read your output. Audience doesn't want to read lengthy books, no, or journals, no. Usually they would just see the abstract and even with the striking title, and if they really like the title and also be convinced upon reading the abstract, then they'll be able to run through with the manuscript or the output. We also have to ensure that the sections are logically ordered and that the narrative flows smoothly from one part to the next, enhancing readability and understanding. And in terms of precision and clarity, there should be a great use of precise language. Say, for example, you're using the English language, the entire manuscript should be in English. Throughout the article, focusing on the key findings and their significance in the context in nursing. So the introduction should provide background of the information, highlighting again the gap, which addresses in the current literature. Usually, what's in the introduction should be the same as what it is in the thesis. However, it is a little bit summarized in such a way that we consider and identify the problem in terms of addressing the gap of the problem, its value and its importance as to why we're doing the research, no? And also it's very important to state the research problem in the intro. And it's a, in these particular contexts, we clearly define the research problem or question, explaining its importance and relevance to nursing practice, which is the value in nursing. In terms of objective, it should be presented detailing what the research aims to achieve and how it contributes to the particular field. So in terms of the method and results section, we have to describe the methodology, detailed the research design, data collection methods, and analytical techniques used in the study. In the results section, clearly present the data and finding without interpretation using tables and figures where it should be appropriate, and the transparency should provide enough detail in the method and results sections to allow other researchers to replicate your study, ensuring transparency and also credibility. So in terms of interpreting the findings, the discussion section interprets the result. This explains the significance of the context of existing research and nursing practice. And we also have to discuss the implication of your finding for the nursing practice, particularly in education, future research, longitudinal studies. You also have in the clinical practice making connection to broader issues in the field. And in terms of summarization and conclusion should succinctly summarize the key points of the study, reinforcing its contribution to the field and suggesting next step. And also, this is one way of validating if the theory that is being anchored to the study is well validated or not. So, what to expect in terms of the process? So, the role of peer review, the process ensures the quality and credibility of your research by having it evaluated in the experts in the field. In terms of the stages of review, typically the process involves the initial submission, reviewer gives feedback, there should be revision. Then again, the reviewer gives a feedback. If needs to be revised, you have to revise it again up until the final acceptance, or even the worst case is the rejection, which somehow wastes your time during the process. So, responding to the feedback, carefully consider the reviewer's comments and suggestions, making necessary revision to strengthen your manuscript. Because they also wanted to see if there are highlighted output that are being added based on their suggestions. Because if there are not, or there are no changes, then there's a big chance that the output might be rejected. So the use of feedback from the reviewers to make revisions that enhances the clarity, accuracy, and impact of the manuscript is very important. We also have to respond to each comment carefully, explaining how you address the concerns or why certain suggestions were not incorporated. And you have to prepare in terms of resubmission. So after revising, ensure that your manuscript meets all the submission requirements before submitting it again to the journal so that there will be no chances of rejecting. So just to give a recap and final thoughts, we have understanding gained in terms of publication process, which is crucial for successfully sharing to the your research within the nursing community. Publication process involves multiple stages of review and revision, each contributing to the refinement of your work, and applying these strategies in your own research writing to enhance the quality and impact of your publication. And let's go to the final lesson of P2, which is translating research into nursing practice. So, translating research into practice involves applying evidence from studies to improve nursing care and patient outcome. Implementing research findings into nursing practice is essential for evidence based care, which leads to better patient outcomes, and its application, which nursing students must learn how to evaluate and apply research to their practice, ensuring that care is based on the best available evidence. So students will learn to recognize various types of studies that contribute to improving nursing practice, including RCT or random control trial, cohort studies, and qualitative research. In terms of understanding, students will be able to understand how to evaluate multiple studies and effectively translate their findings into nursing practice. So, bridging the gap in terms of translating research into practice bridges the gap between theory and real world application, ensuring that research finding improve patient care. So, it's very important that in terms of bridging gap, we need to provide certain situationers and observations if there are no experiences no, by the researcher. And when you talk about evidence-based practice, it has something to do with a research finding which is done into practice, which is a key component of evidence-based nursing leading to better clinical outcome. So your experience in terms of experiencing certain problem of the research is really significant as to how you can bridge the gap. And it's part of EBP or evidence-based practice as well. So ongoing process should have a translating research, which is an ongoing process that requires continuous evaluation and adaptation to ensure the best care for our patient. So some of the quantitative studies would include the randomized controlled trial or RCT. This one is the most reliable one. You also have your cohort studies, which you group different population from other population and you try to study it. And you also have the case control study, which you provide intervention before and after, no, giving certain intervention to that kind of research that you are doing, which would somehow provide statistical evidence for nursing intervention. And for quality, this has something to do with its focus into the experiences and perspective often used to inform patient-centered care approaches. And when you talk about systematic review and meta-analyses, these synthesize findings from the multiple studies, providing high-level evidence that can guide nursing practice. So you're looking into different journals or different outputs, and you're trying to review if these are relevant as to what you are looking into. So RCTs are considered the gold standard in clinical research, providing high quality evidence through random assignment and controlled condition. So RCT helps determine the effectiveness of the intervention, guiding the evidence-based practice in area such as patient care and treatment protocol. And despite their strengths, RCT can be complex, time-consuming, and expensive to conduct, requiring careful planning and resources. A very good example of which is that you're trying to consider a certain study of patients taking antihypertensive medication, and you're looking into consideration as to what are the effects of the medication without giving the intervention or the tablet or pill right after how many particular days that the patient's blood pressure stabilizes into its normal condition, no? So it's one way for us to consider that in terms of randomized control trial, we are not giving placebo effect to our patient, or we're not controlling no our population, but it would somehow reflect as to what would be the outcome of the population right after providing the intervention. That is why it's considered as a gold standard, because we are trying to do experimentation. And yes, this is time consuming because it would really take time. It would not just be in a matter of 2 to 3 months, no? Knowing that giving of antihypertensive medication would somehow be effective enough right after you observe it from 5 or more than that, no? 5 months or more than that. You also have the systematic review and meta-analyses. So systematic reviews and meta-analyses synthesizes findings from the multiple studies, providing comprehensive overview of the evidence on a particular topic. And these reviews help identify best practices by summarizing the result of the numerous studies, offering high-level evidence for clinical decision making, and consolidating data. Systematic reviews and meta-analyses guide nursing interventions, ensuring that the care is based on the strongest available evidence. So usually, say for example, you are trying to review you're doing a systematic review, particularly of an intervention given to a patient who is having difficulty in breathing. So you're looking into consideration in terms of proper suctioning, proper positioning, medications given or management, independent, dependent nursing interventions, and etc. And you look into consideration as to the as based on the output, no, or based on the report, no, as to which one is really effective. And you are trying to consider that in terms of applying it to your patient, no. So usually this is a very good example of systematic review is that when you're trying to do your NCP, because when you are doing your interventions, these are series of literature that you're looking into and you're trying to review as to how effective it is in terms of alleviating the condition of the patient, or based on what would be your goal, or um, what would be your objective for your patient, no. So it's one way for us to check if whatever we try to see in the different books as part of the literature, no, if it somehow be applicable enough in terms of achieving the goal. Okay, so that's a very good example. In terms of quality, we happen to know that this explore our patient's experience, belief, perception, providing rich, detailed insights and quantitative studies may overlook. And at the same time, for quality method, this includes more into interview, FGD, more into thematic analysis right after you've done with your interview and capture the complexity of your patient's perspective. And quality studies inform patient-centered care by highlighting the human aspect of healthcare, guiding interventions that respect patients' needs and even preferences. So a very good application for this one in the hospital is that when you try to go to your patient and you're trying to interview their their experience as to how they are satisfied with the care provided by the nurses, no. So in that way you are conditioning the patient, giving them an idea as to what you're doing, trying to get the gist of what you would like to ask, I mean what answers you would like to get coming from your patient. And at the same time, you also have to consider that your patient will be able to verbalize everything based on their experiences during their admission. We also have assessing quality, which is evaluating research for practice, which is critical appraisal and involves evaluating the quality of research studies to determine their validity, reliability, and applicability of the nursing practice, and consider how the findings of the study align with the current nursing practice, whether they offer significant improvement or insight, or probably critically evaluating research, which nurses can make informed decision about which studies to be implemented in practice, ensuring that care is evidence based and effective. A very good example of an evaluating research for practice is your capstone study, in which you provide a certain interventional plan and you try to look into the evaluative process, trying to evaluate if the plan is really effective right after it is being implemented into the hospital. Okay, so in that way, we are considering if we have to add, or we are going to obliterate something based on the plan, or how can we improve the plan if these goals or objectives, specific objectives, and even general objectives of the plan aren't met. Okay, so it's one way for us to evaluating research for practice based on the capstone study. So steps in translating research into practice. So start by identifying research studies that are directly applicable to your nursing practice and patient care need. So create a detailed plan for how the research findings will be integrated into practice, including protocols and guidelines, and monitor the outcome of the implemented changes, making necessary adjustment to improve effectiveness and ensure sustainability. So in your book, this is seen in still in chapter 2, which you are providing an interventional plan. An interventional plan can be a strategic plan, can be an enhancement plan, no, or um it can be it can be a program, no, in such a way that when you are trying to translate that into practice, it is somehow based on the research findings that you were able to encounter during the research period. The barrier for translation would somehow include certain resources, no lack of resources such as funding, time, personnel, which may not always be available. Another thing is the resistance to change. Those professionals, healthcare professionals, may restrict changes to established practices, especially if it benefits to the new research that are not immediately clear. And also knowledge gaps. There may be lack of understanding or familiarity with the latest research among nursing staff, hindering the translation process. So, to summarize and to conclude, effective translation of research into nursing practice is essential for improving patient outcome and advancing the profession. The process of translating research is ongoing, requiring regular updates and adaptation as new evidences emerges. And nursing professionals should continually engage with the latest research, evaluate its relevance, and work towards integrating it into the nursing practice. So that ends the 5 lessons. And if you have questions, you can place it in the comment section or you can ask me directly in our GC. Thank you for listening.